This is Lab Anatomy of a Frog, Part 3. Part 3 is going to be looking at the internal anatomy of the frog. The internal anatomy is the inside of the frog. So, you are going to lay the frog ventral side up. Ventral is the belly side up. And you are going to check your lab for the incisions that you have to make. The first incision is going to be, I'm going to do it from this way. When you're cutting, you want to make sure your fingers are not in the way when you cut. You want to make sure that now you might have to press firmly, but you do not want to cut the organs underneath. And you want to make sure you go right from the anus all the way up to the top. Now, I've made my first cut. The second cut is to each limb. So, to the right. A lot of this is tissue that you're cutting through. Of course, you're cutting through the skin. Skin is the first layer. That's how the frog breathes. Want to make sure your hand is and your fingers are not in the way. When you're cutting, they should be not. The scalpel should not be going towards your fingers. Sometimes the skin can be tough to cut, along with the next layer down, which is the tissue. The tissue acts as a barrier, a protective barrier for the organs, and you could see here, when I first open it up, you could see some of that pink. The pink represents a blood vessel, and it specifically represents the, here's some blue, also represents a blood vessel. The blue represents the veins, and the pink represents the arteries. And you're going to see it throughout the frog because the blood flows through the blood vessels, which are the circulatory system. I'm just using the scissors to help cut a little bit more. Ooh, all right. So that we can get a visual of the internal anatomy of the frog. Okay. So, again, I'm going to pull this open. I'm going to try to pull the skin apart from the interior. And already I can see these. See these, look, these poppy seeds? Kind of looks like poppy seeds. It's a visual. And there's some tissue on top that is visible. And those poppy seed looking things, those are eggs, which represents the gender of the frog. So the gender is steps. Six and I believe for a female you would see these right away, and for a male I believe it's step 19, and you don't see the testes until later. So right away when you open it up, you see the interior of the frog. Now, First thing you see is these eggs. That's a female. And then you see this big organ. This big organ is the liver. And the liver is actually broken into 3 lobes. One here, one here, and one here. Those are the 3 lobes. You can also see right away these orange, they kind of look stringy. Those are fat bodies. And that helps a frog hibernate during the winter months. Also, you can see the intestines are quite visible. And it's the first thing you see. Now, if I look a little deeper into the frog, you can see the gallbladder here. Also, if you look towards the top, I need a scissors. You may need a scissors to cut some of the protective skin and bone, especially at the top here. So here you can see the 2 different colors. And those 2 different colors represents the different parts of the heart. Now, frogs are different than humans. Humans have a 4-chambered heart, and frogs have only 3 chambers. Trying to pull out the tissue. Now, the tissue acts as a protective covering around the organs. They stabilize the organs, keep them in place. And there's the heart. So the 2 upper areas are the 2 atria. And the 1 lower area, since it's a 3-chambered heart, is the ventricle. You can also see the blue, the veins, and then you could see up here the pink or the red is the arteries. I am at this time trying to get to a visual of the lungs. The lungs are below the heart. It's that gray spot right there. This is the stomach. Again, see how the tissue is kind of keeping everything protected and connected. Here's some more fat bodies. I'm going to try to angle this. So there is one of the lungs. In fact, that is the left lung right there. And flipping the frog around, we're going to try to get a visual of the right lung. Here's that liver. That liver is quite large. And you can see the fat bodies. During the lab, you'll cut those out. Here's the right lung. Right there. And the stomach. Oh, there's that gallbladder that we started with. Underneath the liver. And here's the female eggs. This is a female. If you look further into the cavity on the underside, there is the cloaca, which acts as part of the defense mechanism of a frog. So a defense mechanism is something that happens, or a reaction that occurs as a result of the frog being captured. So the frog is in fear. It's in a fear mode. And what happens is the cloaca, which is storing all of, because it is connected to the intestines, storing all of the waste through the digestive system. So feces, as well as urine, is stored in the cloaca. And then it would be released if somebody were to pick up the frog. And that release would get all over the organism. Let's say it's an owl that goes to bite or eat the frog. That waste would come out as soon as it was captured. And that's the cloaca. And it escapes through the anus. Okay. So there it is. That's the cloaca. It's quite large. I am currently looking for the spleen. The spleen is circular and dark red. Looks like a sphere. And there's the gallbladder again. I'm deep into the cavity. I can actually feel the spinal cord, which is on the dorsal side of the frog, dorsal being backbone. And you could actually feel the backbone. There's the spleen. There it is. Okay. So I'm going to cut some of the tissue around the spleen so that we can get a better visual. Tissue kind of looks like, to me it kind of looks like a plastic bag. And it kind of acts like a plastic bag too. So I'm going to try to get the spleen. There it is. So it's underneath a bit, circular in shape. This is what you will be viewing tomorrow during the lab. Anatomy of the Frog, Part 3, Internal Anatomy.